And that's the big question we're going to find out in just a little bit. First, what do women generally think about their genitals? According to a poll we conducted on discoveryhealth.com, about 22% said they could use some improvement. 7% said they don't feel good about them. But 71% indicated they like their genitals just the way they are. That's most of you. We're back with Dr. Robbin Hailparn. So there's nearly a quarter of people out there uncomfortable, don't like how things look.
Well, there are probably more than that. Because it's over time that women become more aware. Between 20 and 30 and 30 and 40, women become more able to express their sexual needs and become less inhibited, and they also go through childbearing. And both of those have an impact on how they feel about their body and how much pleasure they get from their body.
I remember I talked to Denise and Joe, who you operated on Denise, and she was saying she didn't like how she looked down there, thereby she couldn't feel sexual. And this was bewildering to Joe. Joe was like, you look fine, everything's great, it feels great, but she couldn't.
Well, there's look, and there's function, and there's how you feel about your body, and they're all very much connected. Childbirth can stretch the front and the back walls of the vagina. It allows the bladder to drop down, the rectum to bulge up, it can cause pressure sensations, the opening is wider, and then also the intimacy factor. You're not feeling your partner the way you used to, and sex does change with time, but there are some things that we can truly have an impact on.
So how did you repair this?
Laser vaginal rejuvenation is a procedure that tightens the vagina. It tightens the front wall, it can tighten the back wall, and it tightens the vaginal opening. It can relieve the stress incontinence by better supporting the front wall where the bladder is, and it gives more pleasure by tightening the vaginal canal and the opening. And something else in terms of appearance is the labia minora, the tissue that protrudes from the labia majora. And that tissue can be unattractive to the woman who has them. They can also cause pain and be uncomfortable with intercourse and impact on various activities like biking or riding a horse.
That's where the labiaplasty comes in.
And that's where the labiaplasty comes in.
And Denise had that too, as I recall.
Yes, she did.
She had just one side done.
Yes, she did, because of the asymmetry. One side was longer than the other.
And that's a pretty simple procedure. It's just using the laser and...
It's removing the tissue and then using meticulous, tiny little sutures to put everything back together again.
Interesting. How often do you do these?
I do between 15 and 20 a month right now.
Excellent. When we come back, we'll find out how Denise feels about her surgery and what her husband had to say about it. They'll be joining us here in the studio. And later, everyone has received at one time or another spam or emails about penile enlargement. But stick around. You're going to meet a Beverly Hills urologist who actually specializes in surgeries designed to enlarge the penis.
Most of these men have been ashamed of their size throughout their entire life.
Strictly Sex will return in just a few moments. Ready? Things on? Hey, this is Dr. Drew, and the following program contains candid material which is of a sexual nature. Watch out. Viewer discretion is advised. I mean it. It's not intended that the content of this show be relied upon for medical advice. No kidding. Look, if you believe you require medical or psychological services, come on, consult your doctor. Have you ever heard of vaginal rejuvenation?
No, actually, this is the first time I've heard of it.
If a woman had children, you had say a wife who had babies, and it changed her vaginal appearance, would you encourage her to have surgery to repair that?
It'd be down to her for a decision on that one.
Up to her. Would these women have their vaginas rebuilt if they've been sort of distorted by delivery, baby, that kind of thing?
I understand that. If she wants to, then yeah, I'd let her.
You would have her do it?
Absolutely.
So it wouldn't be so much about what you wanted, it'd be more about what she wanted or needed?
Absolutely.
You get married, and she says all of a sudden, I want to put my hymen back. Sound like a good idea?
Sounds a little weird.
It's really up to her.
I don't know. I wouldn't really care, really. I mean, what's the difference, really?
It would be good for me, but to make her hurt again, wouldn't that be bad for her?
It's kind of confusing, right?
Very confusing.
Confusing, yes. And welcome back. We are exploring how far people will go to enhance their sex lives. We're following a relatively new surgical procedure called laser vaginal rejuvenation. So let's get back to the surgery. The first step in the procedure is the tightening of the vagina.
We've taken out about 1 centimeter to 2 centimeters, 1.5 to 2 centimeters of vaginal wall.
Then it's a matter of pulling the muscles together.
We're we're going to reapproximate the muscles to create a smaller vaginal opening.
This is done by removing excess tissue. The final part of the surgery will address another of Denise's cosmetic concerns. In a surprisingly simple procedure, the doctor shortens one of Denise's labia to make them both the same size. With that, the surgery is complete. Denise will remain in recovery until she's ready to go home.
Hey, Miss Denise, you're in recovery. You did fabulously well. Barely 2 teaspoons of blood loss, okay? How do you feel? Is your bottom sore? Not too bad.
Dr. Hailparn recommends the couple wait 6 weeks before having sex. And with us now are Denise and her husband Joe, and of course, Dr. Hailparn. Now, Denise, it's been 2 months since the procedure. How'd it go?
It went very well.
Did it?
Yes.
What was the recovery like?
The recovery was about 6 weeks long, and it was not as traumatic as I expected.
Not a lot of pain?
Not a lot of pain at all. I only took pain pills for about 2 days.
Did you return to work and sort of normal functioning very quickly?
I did. I returned to work in 2 days as well.
And so the 6-week recovery is until you can have sex, 6 weeks?
Yes.
Joe, what's the deal?
That's what I asked.
I figured that.
To be quite honest, it's just an entirely new experience.
Yeah.
There is nothing that's parallel to the prior experience at all. You feel just, it's completely new. And
better?
And much, much better.
Much better. But now, my goodness, Dr. Hailparn, what's she talking about? What did you do?
Well, when you tighten the back wall and you tighten the vaginal opening, you create more friction, and friction increases sexual gratification. And when both partners aren't feeling it, and you can recreate it and make it tighter, it's better.
But Joe, I talked to you before the procedure, and there was no problem as far as you're concerned.
That's right.
It was going fine before.
That's
Is it
correct.
significantly better now?
It is.
It is. You're surprised. And then you had a concern about the cosmetic aspects of this. You didn't like how things looked.
Right.
You happier with that now, too?
I'm very happy with that. The change was quite significant and very dramatic almost immediately.
Now, if you remember, the thing that was bugging you is you couldn't feel sexual because you didn't like how it looked.
Right.
And he couldn't understand that, and that made you angry.
Right. Well, as women, we have all these comparisons in magazines. Everywhere you turn, everything is labeled with sex. Everything. And if anybody has seen any kind of, sexual magazine,
It looks a certain way.
It looks a certain way, and for the most part, when you've had children, it doesn't compare.
It doesn't look like that anymore.
At all.
So do you feel now you have more sexual feelings, more apt to have sex?
I do.
So you got to be like the magazine again.
Yes.
And that makes you feel more sexy.
Yes.
Do you understand that?
I understand it now.
Or do you care?
He understands it.
He understands.
Trust me, he understands it.
So it's better for you too now.
Yes, it is.
I'll tell you why.
Tell me.
On the third night of my recovery, there's a, I was laying in bed and neither one of us had looked at it yet. And there's an anesthetic cream that you apply for purposes of pain. And I asked if he would apply it for me because I was kind of drowsy, and he turned on the light and he said, "Wow."
That is different. And so, Joe, when you applied the anesthetic cream, what'd you think?
Aesthetically, very, very different, very pleasing. I understood now what she was.
Surprisingly different, right?
Yes, it was.
And you wouldn't. I remember. I'd have to tell you, it was an elegant procedure, and seeing it afterwards, I thought, oh, okay, yeah, I understand why you want to do that. I guess if that's important to you.
Right.
Joe, closing thoughts. Why is it better?
I want everybody to understand one thing. We did not have sexual issues to begin with.
You said that repeatedly. You were
yes,
sort
I
of
did. I want to
bewildered
stress that. Sex is great, frequent, climax, all that good stuff. But if you can take that and multiply it by like 1,000, if you can imagine, it's just better. I don't know how to explain it. I did not know what I was missing because it was such a gradual process. Again, I think if this would have happened overnight, the relaxation, I think it would have been noticeable.
Yes,
but because it was the duration of, we're talking about 10 years now that we've been together.
And if I could paraphrase, your wife wants to have sex with you more often.
Yeah.
Okay. So, okay. Thank you, Denise, Joe. Thank you, Dr. Hailparn, for the information on laser vaginal rejuvenation. If you want more information, go to our website at discoveryhealth.com.